Hi, this is Jessica DeMassa, and I'm here in the GuideWell Insights Lounge at Singularity University's Exponential Medicine 2017. I'm here right now joined by Dr. Brennan Spiegel. He's the Director of Health Services Research at Cedars-Sinai. Hi, Brennan. Nice to meet you again.
How are you? Good to see you.
Good. And we spoke at a different conference, but it's exciting to hear about some of the new things that you're doing in virtual reality.
Right.
And so I understand that you were on the main stage a little bit earlier, and you were talking about basically where we're at right now in terms of VR being integrated into really practical treatment modalities and things like that. So give me a state of play. Where are we with VR?
Yeah, well, we've treated now about 2,500 patients at Cedars-Sinai with therapeutic virtual reality. And, we have an opioid epidemic in the US, we know this, and we're looking for ways to manage pain without opioids, without narcotics. And what we've been learning is that virtual reality is a very powerful way to help reduce pain through a combination of sort of distraction therapy and mindful meditation. And we've recently published some studies that shows that VR can reduce pain by about 24 to 25%, which is about what you get with opioids.
Okay, so talk to me a little bit about how you did that research and how you arrived at proving those outcomes. So how does VR, I guess, help do that?
Yeah, well, we still know exactly how VR works. It's sort of like a spotlight. So, any viewer who's used virtual reality knows what it's like. And if you haven't used it, it's sort of theoretical. But VR shines a spotlight into the brain. It's like overwhelming the mind. And the mind can only manage so much at once, only so much data.
Sure.
So what happens is the brain is so overwhelmed with processing this data that it has difficulty experiencing the pain, or the nociceptive signals, we call it, coming up from the rest of the body.
Sure.
So it runs distraction, but it also provides mindful meditation. And we see that even after VR, patients continue to have pain benefits that can last for minutes or even hours or days in some cases.
Does it change what's going on in your brain in any way?
It does, and there's been research looking at functional MRI scans in the brain, and it's probably a similar effect as yoga or mindful meditation, which does affect the way the brain works.
Sure.
What's cool about it is VR, although we use it for maybe 10 minutes at a time, it has persistent benefits, and even after about 2 weeks, some of our patients find that they don't really need the VR anymore. It's like they've learned how to conjure this ability with their mind that they didn't know that they had. It's like we've given them a superpower in some cases.
Okay, so do this for me. Walk me through like a really specific example of how you're applying VR. Like, what is this? Like, what are they looking at? What are they doing? Talk to me.
So we've got a library of about 30 different visualizations, and we work with our partners. They're called Applied VR. It's a company in Los Angeles, and they're actually here at the Exponential Medicine exhibit hall.
Sure.
And we work with them to craft the right kind of tailored prescription for each individual patient. Different patients have different expectations for what they want out of virtual reality. So we find the right combination of visualizations and prescribe it. And they take it 3 times a day for 10 minutes at a time.
Okay.
And we take them to use it, tell them to use it for breakthrough pain. And we treat them throughout the course of their hospital stay.
Okay.
And we're seeing incredible benefits, and now we're starting to use it in outpatient settings too.
So I love one of the things that you had said during your talk, and it was about VR being used as a therapy, and if that's the case, needing to develop a VR pharmacy.
Absolutely, right.
So talk more about that, because I think that's a really interesting concept. What does a VR pharmacy look like?
Right, so the point is that VR works. I mean, it does work. There's now been 11 randomized controlled trials. We're about to publish the 12th. So there's no shortage of data
that shows it works.
Virtual reality does work. It works for anxiety, for depression, for phobias, for blood pressure management. We've been using it, so it works. So the point is, if it works, we have to start thinking about it like a pharmacotherapy. So just like I have a pharmacy for medicines, we need a VR pharmacy, so I can pick the right prescription off the shelf and map it to my patients just like I would with a regular pharmacy.
That's such a mind-blowing idea. I just think that that's really... do you envision that being a shared, like accessible pharmacy, like the same way I guess that drugs are shared? Or?
Yeah, so we're kind of developing the Netflix of therapeutic VR right now with Applied VR. We're helping them to develop that. But if you go to YouTube, there's hundreds of thousands of VR videos now. Just type in VR beach, and there's no shortage of stuff. So it'll be widely available to a lot of patients.
Fantastic. Well, Brennan, thank you so much for joining us and for giving us an update on how VR is being used in the healthcare system. I'm Jessica DeMassa here in the GuideWell Insights Lounge at Singularity University Exponential Medicine 2017. Thanks so much.